On today's episode of Dance Med Spotlight, I am speaking with Dr. Marisa Hentis. She is a performing arts physical therapist and faculty member at the University of Southern California. She has her own experience as a dancer growing up and dancing professionally, but now is in this really incredible space at USC where she is supporting the physical therapy program, the dance program. She's the director of the dance medicine program, director of the Performing Arts PT Fellowship, and a big part of the Performing Arts Special Interest Group in the American Physical Therapy Association. What this all boils down to is there is some really great information in here for so many different people. If you are involved in a program like perhaps a BFA type program and want to know more about how you can provide some support from the health and wellness perspective for your dancers, you need to listen to this. If you're in a physical therapy program and thinking about how you're supporting future physical therapists who are interested in working with dancers and other performing artists, thinking about what's in your coursework, residencies, clinical rotations, supporting something like a fellowship program and getting students ready for things like that, you need to listen to this. We also talk a lot about, just from the physical therapist standpoint, people who are interested in getting into this space, opportunities that there are available to you so that you can further your knowledge and your training and involvement as a performing arts or dance specific therapist. So really what this boils down to is if you are really in any shape or form related to the dance medicine space and dance community, you need to listen to this episode because there's a lot of good stuff to pay attention to in this one. Welcome back to another episode of Dance Med Spotlight, where we talk about all things dance medicine and dance science. Today, I am excited to have Dr. Marisa Hentis, a physical therapist specializing in dance medicine. Welcome, Marissa.
Thank you. I'm so happy to be here.
So Marissa, the very first question that I always ask everybody on here is, what got you in this space of being a dance medicine specialist?
That's a great question. I love this question as well. I kept coming back to dance at every stage in my career. I tried stepping away multiple times and it just kept pulling me back. I always knew I wanted to be a physical therapist, very young. Actually, I was in high school when I knew I wanted to be a PT.
Oh, nice.
I had two friends who get into very serious accidents. One was an ortho skiing accident, another was a car accident. And they were both inpatient hospitalized for like 4 to 6 months. And I saw them get back from inpatient hospitalization all the way back to their sport. They're now thriving adults. They're back to athletics. One's an ultra marathoner. And so seeing that transition, I always knew I wanted to become a physical therapist, but I didn't know that dance medicine was a thing at that time. Some people did, not very many people did. And so throughout my entire career, I just kept getting drawn back to dance, drawn back to the arts. I tried collegiate dance. It just wasn't a good fit for me. It was more cheer dance, and that wasn't my style. I ended up joining a professional company in St. Louis while I was in undergrad and graduate school. And so from there, I was really dancing professionally while going through PT school. I was also coaching a high school dance team at the time. And every time I tried to step away, something kept pulling me back. And it wasn't until I had been through PT myself many times throughout my career, but it wasn't until I had one big injury. I was probably in my third season of my professional career, where my doctor was like, you can't see a normal PT anymore. You have to go see this one person. They're a dance medicine specialist. And that's when it really opened my eyes. It's like, oh, I could do this as a career. And from that moment on, I started changing everything and focusing on every school project I had was towards dance medicine. I was the one who would go to my professors and was like, I need a clinical in dance. And they're like, that's not a thing. And I was like, well, great. Don't worry. Here are 10 options that I found for you. And so they really kind of helped me find some of those avenues. And then after I graduated from PT school, I went through residency just because I wanted that more mentor experience. And I was so fortunate that my resident director at the time, she was also involved in the performing arts. And so we're good friends now. But she really kind of helped me lead the way and find out how to get involved within the community. And so then really started pushing along until I landed my current position where I'm head of dance medicine at University of Southern California. And we, in fact, just started our own fellowship. So the first one on the West Coast, which will be really exciting.
Yeah, that's awesome. And I think there were so many things that you kind of hit on that feel familiar to me of having these experiences as a dancer growing up and then getting into PT school and kind of going, maybe this can be a thing. Like I remember for myself, I had been on my second clinical rotation in PT school up in Washington State. I went out of state just for fun. And my PT that I was working with was phenomenal, but she had a young ballet dancer who she got back to normal person everything, but not dancer stuff. And I was, I still had a lot of school left at that point and was just sort of scared to raise my hand and say, hey, can I try some stuff? Because I came from a dance background. And she said, yeah, sure. I'm kind of running out of ideas. And I got her back where she needed to be in 2 weeks. And my CI, my instructor, had said, I would not have come up with the things you did because I don't have that context and that, like that knowledge of movement and that sort of thing that was so specific. And that was my very first, maybe this could be a thing.
I know. I feel like it happens to all of us.
Most definitely. So to kind of talk a little bit about the variety of things that you do, you're involved in a faculty position in biokinesiology and PT at a school of dance, director of the dance medicine program, director of the fellowship, and you're the screening chair for the American Physical Therapy Association's Performing Arts Special Interest Group. That's a mouthful.
Yes, it is.
So you really have an opportunity to see this dance medicine space from so many different angles, which I think is really cool. What would you say is, I guess maybe like one of the things that you see, particularly in that faculty side, being on both the PT faculty and in the School of Dance?
That's fantastic. I love this question. I love that I am personally involved in the dance community beyond the PT realm. PTs, we're all very opinionated. Everybody knows that. We try our best to keep up with the literature. We're doing what we can from a sports medicine perspective and pulling it into our physical therapy perspective. But I can actually take all that information and pull it into the dance school to start changing the ways we're teaching. The pedagogy is changing. We're trying to change the students in their practices from the beginning so that this way their careers are hopefully living longer, dancing longer, and everything from that perspective. That's obviously our ultimate goal. But what's most interesting is then I still have the challenges of the dance world and the dance culture that is present from an administrative perspective, from a faculty perspective, and not that our faculty and our administrative are not wildly supportive. Like they blindly say, okay, Marissa says it, we're going for it. Even the thought of like tapering during show week, they had already tapered some during show week, but even tapering in other ways, which are fantastic, and teaching faculty to be able to utilize the current information to bring into the classroom has been really rewarding. The best example is we just implemented an entire concussion protocol, and it was very specific. Last year was launched, and administration actually came to me about it and was like, we think concussions are actually a bigger issue than what we're leading on. What is the research saying? And I was like, well, there is no research. There's like one article, maybe 3 now, on dancers in general. I was like, however, I'm seeing roughly between 3 to 6 concussions a semester. They're like, oh, that's actually a lot higher than what we realized. let's have a formal protocol. And so I was able to actually educate faculty, staff, production staff, and crew for all of our shows on what concussion symptoms are like. We were able to implement a protocol. We actually had a mini quiz for everyone in the building, including students, and it was low risk. If you were semi-present while I was talking about concussions, you were able to pass. And then what the big change I saw from there is I was expecting faculty members to turn students in for concussion symptoms. But in fact, the students started turning in other students for concussion symptoms more than the faculty members, which I was like, that's amazing. That's actually making cultural changes in education from a student level. In 18, I had suffered concussions, but I couldn't pick up someone else having a concussion.
Right.
And so for them to be like, someone hit their head in rehearsal and now they are really agitated at me. I'm like, okay, you can send them in. I'll come assess them. Or they turn themselves in more often. I shouldn't even say turn themselves in. They come find me to get checked out more often. They're like, I got hit in the head. I feel fine, but I figured I might as well get checked out.
Yeah. I love that. And that's such a beautiful balance of being able to affect change on both sides. On the PT side, you're able to teach them about some of these things to understand that might be a little bit more unique to an aesthetic athlete. And then on the dance side, you get to have that cultural shift and everything and just sort of ingrain it from the get-go. And I think that's one of the most powerful things that I see, even just in the clinic, being able to educate individual dancers that come in and their parents, or, maybe a sibling that comes along for the ride, and they get to learn some of these things. So then when they are eventually away from me and, they've gone on to a company somewhere, whatever, they are able to take some of that information with them, have better awareness for themselves, advocate better for themselves, and maybe advocate for somebody else who maybe didn't receive some of that education, but they're now spending time around.
Yeah, absolutely. And it's so great to finally see it. And then as I start to work into more professional companies that are in LA on tour, I kind of cover some of those companies, then seeing where it's like, oh, you all are a very well-renowned professional company and you don't have a concussion protocol. You should think about implementing one. I can't tell you what to do, but you might want to consider that.
Yeah, definitely. I love that. Talk to me a little bit about this journey of helping develop this PT-led collegiate level dance medicine program.
Yes, I was very fortunate that the timing worked out in my favor in order to be at the position that I'm currently in. So when I first was hired at University of Southern California in 2019, that's crazy. I've been there for 5 years already. They had a very standard PT model across a lot of other institutions in the area. A PT would come in 2 to 4 hours a week, would help their dancers, maybe add a couple more hours here or there before show week or during show week. But really, it was more rehab based. You come in, you're duct taped together, or you try to find a physician, you do what you can. They were 15 to 30-minute appointments at most. But that was all they knew what to do and they knew how to do at the time. And it wasn't until that first year where my supervisor said, you all need more PT. You actually need to model it based off of athletic medicine. She's an athletic trainer and she works in the athletic department also at USC. She's like, you need more a model like them. Your dancers are dancing way more hours than kind of what anyone realized. Or I shouldn't say realized because they knew, but it wasn't until they were there in person seeing the injuries that they realized the extent of them. And they said, you need to actually hire someone to do this as their entire job. And so I have to give credit to my supervisor, Amy Diaz, where she went to the School of Dance Administration and set up the entire program. And she said, I don't have time to do this, but let's find you someone who did, someone who does. So that's when I was brought on. And so at that time, the whole program was really a blank slate for me. And they said, what do you want to do with it? How do you want to run it? This is your program. Let's figure out what you want. And obviously, with PT administration and dance administration, we found middle grounds at a lot of things. But there was a lot of things the dance administration did that really surprised me. Like originally, I wanted to set it up as more of like an HMO program where every dancer got 10 visits. And then after that, we switched over to insurance coverage. And the dance administration said, nope, absolutely not. Every PT session is covered. The institution will cover it. I would much rather do that and make sure everyone has the coverage that they need and not have to worry about insurance and have to worry about any of those. And we said, okay, I mean, that makes my life a lot easier. It makes things more seamless and more smooth. And now, to my knowledge, we're really the only program that I offer anywhere my semester hours shift here or there, depending on my teaching schedule. But we offer 20 to 28 hours of PT covered by their tuition weekly. And we have 106 upcoming students this upcoming year, which is still a lot of students, understandable. We still have backups, and the students are really good about saying, oh, you know what, my knee pain's not that bad today, but your foot pain's really bad. Let's just switch appointments. I'll go see Marissa next week. Things like that. And so it was really great, and things are constantly changing, and which is obviously one, academia always changes, but then two, it's also nice because I can see what other programs are doing and I can implement them instantaneously if I want to. So we have for example, a really good, well-developed wellness program where we have pre-participation screens where they first started out voluntarily. The students could get one if they wanted to, but they didn't have to get one. Now they're required for all students. We actually have the exact same pre-participation screen that all of our D1 level athletes have. So the university at large is now on board being like, oh, these dancers actually do need better healthcare, and we need to treat them with better healthcare. And it's been fantastic from that way, where I'm very, very fortunate where administration, both at the dance level, the PT level, and the university at large, are very supportive within budget constraints, obviously. But
yeah, kudos to the administrative folks there for getting all of that going. And I think, to kind of go back to one of the things that you had mentioned there, this idea of bringing them up to the same level of resources and attention and support as D1 level athletes is a huge thing. I mean, we've seen that in the last couple years in the collegiate dance space, where there have been arguments of the differences that sometimes are seen when it's the dancers versus someone else. And so, yeah, way to push the envelope a little bit there in favor of the dancers.
Absolutely. I mean, my favorite statistic, and this is the thing I say every single time I go into a meeting with either student health or administration, D1 level athletes have restrictions. They are only allowed to practice and perform 20 hours a week in season. Please find me a dance program where they're in class 20 hours a week or less. And then, not to mention additional self-rehearsals on the side. There's self-projects. A lot of collegiate dancers are also trying to work in the professional world as well, especially in a place like Los Angeles. Like, a lot of them are signed with agencies, and they're going off and they're doing small mini tours in between their breaks, or they're doing commercial shoots or music video shoots on the side. And it's like your hour level is pushing 30 to 40 hours, and nobody does that, not even professional level athletes. You very rarely are actually physically dancing 40 hours a week. Yes, you're still employed 40 hours a week, but you usually have a little downtime here, a little downtime there.
Yeah, exactly. I have a high school intern right now who is in soccer. He's going to be a high school senior, and sounds like he plays at a pretty high competitive level of soccer. And as he's been learning about the dancers and hearing what a normal week is, even for a 12-year-old that comes in to see me, he just always has this look on his face of oh my gosh, how do they do this? And what are they doing? And hearing that, there isn't particularly an off season most of the time and that
Nope.
sort of thing. And it's just, he's totally floored by the whole idea. And so it's been interesting having him in there with me to kind of really notice more of those differences.
Oh, I know. But then looking at the resources from any collegiate athlete compared to most dance programs, and we're extremely blessed with the resources we have, and the students are still constantly complaining, like, well, why do the athletes get that, but we do? I'm like, well, they have a different budget.
Mm-hmm. Yes. I remember talking with somebody who is a PT for a big ballet company. And we were kind of having a little chat about that and how they sometimes would talk with other healthcare providers that worked with some of the big, even professional, football teams or baseball teams or things like that. And they would start brainstorming ideas and like, hey, you guys should do X, Y, and Z. And the PT with the ballet company would just say, that's a really nice idea, but we definitely don't have the funds in order to support that.
Yes, I know. And we're so fortunate where I don't think it's fair that all the dancers have to see me for physical therapists. Everyone should have the choice in their healthcare provider. So we have an additional physical therapist who only covers like 2 to 4 hours a week, depending on the time. But he works with the athletic center. So oftentimes, if he can't fit them into their schedule, he's like, well, just come on over to the athletic center during lunch. And then we have access still to all of the athletic center equipment as needed. And so we have a couple who are in ACL protocols where I actually can get them on an Ultra G because we don't even have a treadmill, let alone an Ultra G. We can get them running sooner in a pool and taking off their body weight from an aquatic perspective. But again, no dance program is going to have access to aquatic therapy unless you're paying for that out of pocket somewhere else.
Yeah, definitely. Mm-hmm. Talk to me a little bit about some of the wellness programming that you have for the dancers. So for people who are listening, who are maybe, either providers or members of the dance community who are like, what is this thing you're talking about? Maybe talk a little bit about what is a wellness program, and then more specific, what does yours look like?
So that's great. And I think that comes down to definition perspective. And so we have it very well defined. One, I have it well defined so that when I go back and I finally research all of my PT stats, that I'll have that availability, but also for the students to be really clear on what's considered rehabilitation versus what's considered wellness. So rehabilitation is defined as you have pain somewhere in your body or discomfort that causes you to modify the way you're dancing or moving throughout your life for more than 48 hours. So if you're really sore from your muscle perspective, it could be muscle soreness, but if it's lingering past that 48-hour mark, it's actually written into our dance medicine protocol that you are supposed to come see me. Or if a teacher sees you out 2 days in a row, then they have the right to say, okay, you have to go see Marissa and get cleared before you come back to class. So I start with rehabilitation first because it's easier to define rehabilitation. And so wellness is anything else that doesn't fit into that category. And so that can be students being like, I'm having a really hard time recovering after this one rehearsal. Every time we rehearse this one piece, especially depending on the rehearsal director for that day, if they make them run it 2, 3, 4 times in a row, I am sore for 2 days and I can't participate in class. So then they'll come to me. It's not discomforting, it's not pain, but they know they're not working at their peak capacity. That could be an example of a wellness. Or a lot of times faculty members will come up to students and they'll be like, oh, you're not working your serratus anterior muscles in your port de bras. Go see Marissa for that. And then even though most of them have taken anatomy with me, then they say, I forget what that muscle is. Will you help me with this? I'm like, yeah, absolutely. And then we go through a quick assessment. I give them a workout program or I give them an actual schedule. So that's one component of our wellness program. So we actually offer shortened PT appointments. That is considered wellness, where I'm really helping them improve their peak optimized performance. And so oftentimes we're working with timing, like how to work on your timing perspective. Maybe how to get through a long day. Maybe they're fine in the morning, but then towards the night, they're not recovering or they're not able to perform in their night rehearsals the way they're supposed to. Like I said before, it could be working on specific exercise programs. I've had some students come in being like, my agency says I don't have enough muscle bulk on my arms or legs. Will you help me with that? So then we're altering their outside workout program. I also am Pilates trained. I'm not Pilates certified, but we're very fortunate where we have a Pilates instructor on faculty and we have a gyrotonics instructor on faculty.
Nice.
And so sometimes students will come in and they'll be like, I think I want this, but I'm not sure which one's better for me. I don't want to waste the faculty member's time or my time. And so we might try out some Pilates things, or we might work through with what they're feeling and then determine kind of who to go from there. Or if a student has finished their rehabilitation, they can kind of come back to me for like checkups to make sure that they're keeping up with their strength, or they don't need to optimize or change any of their exercise program. So that's one option that we have for wellness, which is very, very fortunate for us. Our other option is we do more global wellness programs. So we do things called Wellness Wednesdays, where it happens, we try for monthly, but it happens more like twice a semester, where we bring in outside people to hear information. So one time we brought in our registered dietitian, who's our main liaison for all of our dancers, just to introduce herself, especially to first years who haven't seen her before. She played a game with them. They did some things with nutrition. We usually have to bring in food or drinks in order to get students to be there. We've done other wellness programs where we've done like mindfulness meditation, where the whole session is just learning how to meditate for dancers, or learning how to incorporate more of that mental imagery for dancers. We've brought in peak performance psychologists before, so sports psychologists that are focusing more on the performance aspect, just to give some tips and tricks. So those components of our Wellness Wednesdays, those aren't medical treatments. Those are more like outreach programs and things like that. But then we've also done Wellness Wednesdays where we've just had like a coffee hour where we tell the students someone's coming, like within the medical community, and we try to get them there. But when we get there, like, surprise, it's actually just hang out with your friends for an hour. We canceled classes this way, because that's also a part of wellness too. And they are juggling being college students, and especially for our first years and even sometimes our second years, or like this is their first times being away from home for long periods of time. They're still trying to figure out how to also be adults and be humans, and how to do your laundry and things like that. So that's also part of it as well. And so those are our two main components within our wellness. But then we also try to incorporate it in terms of other resources on campus, which are amazing. We have a lot of opportunities at a large institution where we have organizations who are hiring or have grants and bringing in like major dance companies to come perform for the larger body. So it's not just for our dancers. And so then we'll have a little meet and greet with a dance company that's coming to perform, so that this way they can mingle and meet with the directors and meet with the company members. And even though that's still networking, it's still a part of the bigger experience of how to work and live as a professional in this industry.
What I hear is just so much support in different areas. It's not just the rehab when somebody's dealing with pain or injury. It's not just providing them with some education about other aspects like mental health and diet and all of those kinds of things, but also providing some of those downtimes and networking opportunities and just learning how to human, much less learning how to dance and dance safely and in a healthy way. And that is just awesome that you're able as an institution to provide all of those different aspects for the dancers that come through.
Absolutely. I mean, we're trying. Everyone has room for improvement. And I'm sure our students would be like, well, you could do this, you could do that. But they also are very well aware of how grateful they are and what opportunities they have at USC compared to potentially other institutions, or in the real world when they're with a company and then they look back, they're like, oh, that was really nice that I did have all that available to me at that time.
I think as some of these things start to become a bit more common as well, of having some sort of support, some sort of wellness programming, knowing that there are dance medicine specialists out there, not just as physical therapists, but in a lot of different professions. I think dancers as they're looking for training programs, companies that they work for, jobs that they get hired onto, they can start being a little bit more critical of what am I signing up for and what other support is happening, but also help affect some of that change as well, as some of these companies are maybe going, people maybe don't seem as interested in coming to us. We don't offer these things. Maybe we need to consider it.
Absolutely. And in fact, I was also going to bring that up as well. And so our last graduating class, so class of not 2024, 2023, I actually worked with a senior who that was her senior project, was interviewing herself before and after auditions to see, one, what was the vibe of the audition? Like, how did she feel? Did she feel like the company made her feel supported? Did she feel like the company made her feel like just a number? What resources were offered from the company? And she said, she was like, there were a lot of times I made it to a callback and I denied it because I didn't like the way that I was felt or seen in the audition. And then when I looked up the resources they offered, it didn't align with my values. So I left. And I was like, good for you. I was like, it's a two-way street when it comes to employment. You have to want to be there and they want to have you there as well. And I agree with you completely. I think larger companies and even smaller companies are really starting to notice that, especially with this new generation coming up into the professional world.
Let's switch gears a little bit and talk about this Performing Arts PT fellowship that you are the director of there.
Yes, we're very excited. We're currently in the process of become accredited through APFTRE, which is, oh my gosh, I have to make sure I remember all these acronyms correctly. American Board of Physical Therapy Residency and Fellowships. And we're currently waiting to hear back from our candidacy phase. And so right now, currently, there are only 3 accredited fellowships across the country. They're all on the East Coast. And so it was always my dream when I started at USC to start a fellowship on the West Coast. And it finally was a good spot where I felt like I had enough connections around the university to really make this a well-rounded program. And so what's really fantastic about this program is that it is well-rounded from a performing arts perspective. And so I already have well-known established connections within the School of Dance, but I've been working hard for the past couple of years to work with our School of Music and our School of Dramatic Arts and our School of Cinematic Arts. And so it's going to be kind of a combination where the fellow is a licensed physical therapist that has either a board certification or has completed residency training can apply for the program. And then they'll be able to work with all performing arts across the university. We also have connections with a lot of clubs on campus. And I think that's where a really big missing piece was when I first started developing the fellowship was I knew there were dance clubs, but I didn't realize, one, how many and how diverse they are. And so recently an organization popped up on campus and they're called the Southern California Dance Collective, where all of the dance clubs on campus can kind of come and be housed under one unity to be able to help with connections, to be able to help with budgets and resources. They also put on shows, and the program, SCDC is what they call themselves, is made up of a ballet company, a contemporary company, there's a tap company, there's a K-pop group within there, there's multiple hip-hop groups, there's also a capoeira group within there, and there's so many diverse forms of dance that I'm really excited that I'm starting to work with them a little bit more. We're going to start covering their shows so that this way, even though they are regular university students that have an interest in these, they are clubs, so it's more than just a recreational dancer picking up an odd dance class here or there. Like they have rehearsal schedules, they're working through that, but they don't have access to anything on campus unless they find it themselves. And there are resources as a university student, but they're hard to find sometimes. And so even their last showcase, I just presented at the very, very end of their showcase being like, hi, I'm Marissa. I'm a physical therapist that specializes in performing arts. You all have access to me on campus. And the amount of people that came to me afterwards was like, I didn't even know PT was on campus. And they're third years and fourth years at the university. So I'm really excited for that, so that the fellow can kind of work with them a little bit more. And so it'll be a really good combination of didactic work with clinical work and backstage coverage to be able to kind of be really well-rounded within the performing arts. And so not even just dance. We're working with our musical theater students. We're working with our theater students, our vocalists, our musicians, including any string instruments or brass instruments or any other form of instruments. And there are so many students on campus that fall under the performing arts that need similar or the same resources as our dance program that don't always have one time or two access. And so that's really what I'm trying to bridge the gap with, as at the same time training future clinicians and already experts at the level on how to be performing arts physical therapists, so that this way we have more consistency across the country when tours are coming through. We have a larger network. We need more people within dance medicine. The community is already spread out and diverse, but we all have little pockets of who we know. And so by training people and bringing up more, it's just going to give better access to all performing artists to be able to get the care they need.
I think you hit the nail on the head there of we need more performing arts practitioners, whether that is PT or otherwise, dance specific or otherwise. I know even just in my own local community, the last time I looked, and this was years ago, so who knows what the number is, but within, I think, a 15 or 20 mile radius of my clinic, there's something like 63 dance studios. That doesn't even include high school programs, dance teams, POMs, companies, performing arts schools. Like this is literally just traditional studios that do ballet, tap, jazz, whatever, also excluding Irish dancing, cultural dance. I mean, it's excluding a lot of different groups that could be under even just the dance umbrella.
Yes.
And I'm the only dance specific person in that little radius. So it's insane to think about how much opportunity there is to better support performers of all sorts. And so things like these fellowship programs or shadowing opportunities as a student, clinical rotations, residency hours, whatever that we can get that are more performing arts specific, the better.
Absolutely. Even clinical opportunities for students who aren't even sure, do I want to do this for a living? Do I not want to do this for a living? Giving them that experience as well is also very necessary. And so PT schools needing to also reach out to performing arts professionals and dance medicine specialists and giving them the opportunity from there is so needed.
Yeah. I am actually just like as of 2 weeks ago, started working with a resident who's working on her orthopedic certification. And she comes from an aerial background, but she wanted some mentorship within performing arts and dance specifically. So she reached out to me. And so I now have my first resident to do her hours with in the dance area. And it's, I mean, we've only have one big day under our belt so far since we've started, but getting opportunities for her to be in the clinic. She's going to help me with a couple on-site things, whether it's like a more of a convention type day and then competition weekend. So giving her some diversity of experience with all of that. But it's really exciting to be on that side of it now too, to kind of help provide some of that training.
And I can tell you that I'm sure the resident is so excited and so grateful for the opportunity. I know I was when I was a resident. I was hungry for any experience I could get, and I was fortunate. I was in Boston at the there's a huge dance community there, and I was able to find a network and people really needing to be open to teaching and sharing your expertise. And there are enough patients to share, and we can all share them, I promise. And no one's schedule can be that low in terms of anything from that perspective, because the dancers want specialists. It's you get better care, you want to be talking to someone who understands your language, or at least someone willing to try to understand your language. I mean, I've learned so much in my career already, and there are still new forms of dance that I'm not aware of. Like the first time I worked with someone that was a capoeira dancer, I was like, well, let's look this up together. And then it turns out my coworker, who's also a dance medicine specialist, she's like, oh, I did capoeira for years. She's like, this is what you really need to work out for. I'm like, well, first of all, one, I did not know that about you, and that's amazing. And two, yes, please teach me. And now I feel like I have a little bit better understanding to be able to connect with any patients in the future.
I think that also is a nice little segue, kind of thinking about things within the dance medicine space. When we look at particularly a lot of the research that is out there, a lot of it, the vast majority of it, is really based in professional adult dancers. Ballet, modern, contemporary are definitely very heavy on the spectrum. I see a fair amount of Irish dance popping up, but beyond that, it's a very little sprinkling across any other styles of dance. So being able to be in a space like you are and getting access to these other clubs that have the other styles is such a great opportunity to do some research in those other styles as well.
Yes, you're looking at my 5 to 10-year research program currently. I have a lot of research ideas and endeavors. I'm currently finishing up with trying to get normalized data for collegiate dancers so that they know what the norms are, because currently our norms are only on professional level companies, really. And again, most of them are ballet companies, a little bit here, a little bit there. But you can't expect a 17 and an 18-year-old to be at the same level as a 25-year-old who's been dancing professionally for years at that point. And so trying to get that normalized data. And then I'm really interested in looking at more heterogeneous population. So by that, I mean not somebody who does the same style of dance every single day. I grew up a multi-genre dancer. The company I was in when I was dancing professionally, we were multi-genre. We were considered a contemporary hip hop, but realistically, we did what got us paid. If somebody wanted a musical theater piece, we learned a musical theater piece. If someone wanted a tap piece, we did a tap piece. Tap is, I can tap, but I am not a great tapper. Don't put a mic on my feet, that's for sure. But I'm a really good background tap dancer. And I'm really interested in, is that enough to not be so specialized? We have a lot of research on sports specialization in the youth population where it's not good for the youth population to be doing the same sport over and over and over from a very young age. But where does dance fall in there? And that's one of my really big questions. And so I'm still figuring out how to look into that specifically. I would definitely have to team up more with an institution that does more heterogeneous or more same style only. So like a program where you major in ballet or you major in contemporary to see kind of, is there any differences in what they are? Our program requires every student every single year to take ballet, contemporary, hip hop, and an elective. And so we require at least 3 to 4 styles, but then their rep that they're learning in their rehearsal pieces are not the styles that they're learning in technique. So they could be doing a counter technique piece, but they're learning Horton and contemporary. And even though they both might fall under contemporary, those are 2 very drastic different styles of contemporary. And so I want to see, is that good for the dance community or is that not good for the dance community? We actually need to match technique to performance levels. And there's always an ongoing debate and you'll hear it from both ends of the spectrum. But we don't know what the information could potentially say about it.
There's so much that we're extrapolating from general athletic research and sports research that, we don't know quite how some of it applies to dance. Whether it's early specialization, hours of training, and even thinking of, some of the training and activity levels. Historically, dance hasn't included a lot of cross-training and push for cross-training and that sort of thing, although we'd like to see that change, and we are starting to see that. But, how does that affect each one of them differently? Is there enough kind of cross-training-ish stuff happening if they're across a lot of different genres of dance? Do they need other specific things? What would those specific things be? We have questions.
So many questions, and I wish I had more time to answer them. And a lot of my research is clinical based. So I want to see what happens from a clinical perspective with the results of my research. And there's a lot of really good biomechanic and kinesiological researchers who are looking at each joint motion and things like that. And I think that's really good information. And we need that starting point in order to be able to apply it to the clinical research base. So we need more researchers as well, which I think is even harder to find than a dance medicine specialist.
Mm-hmm. One of the things I've often heard talking about dance and performing arts specific research kind of goes back to the same thing we were talking about earlier of the availability of support and funding, even for wellness and healthcare support for these folks. It's kind of the same thing. It's sometimes getting the funding as a dance or performing arts researcher can be a bit more challenging versus like ACL tears in football players, for example.
Absolutely. I mean, the availability of grants out there are less for performing arts specific, or you're competing against larger institutions that have a bigger budget behind them. And so I can totally understand that. I mean, all my research is non-grant funded, and so it's through my own time when I can fit it in. But I can also tell you that if I have a dancer at my door that has an ankle sprain, or if I have time to do an hour of research, I'm going to treat the dancer in front of me instead of doing my research, which is also probably why my research can take a little bit longer than others.
Right. Yes. That clinical side, definitely. Mm-hmm. I can appreciate that for sure.
Yeah, I know. And then I'm also fortunate to any PT student who's interested in getting in research. And so I'm like, great, you can help me with my project. Here you go. And then we work on tasks together, which makes things a lot easier too. So if you are a PT student interested in dance medicine, but you're not sure how to get started, I would say that's one of the easiest ways to reach out. Ask your faculty members, are there any projects, are there any research projects going on with dance specifics or performing arts specific? Start getting involved there, because you're going to learn so much just from, even if it's data entry, is very helpful to be able to see how other people do it.
Definitely. One of the things I often offer up for PT students as well, or even pre-PT students, is some of these events where I'm going and helping on site, whether it's doing coverage or doing a seminar, masterclass, like whatever that looks like. A lot of times I could use at least one extra set of hands, even if it's just to help greet people or pass things out, or, it doesn't need to be a lot, but it can make a really big difference. And so, I'm always looking for students to get involved that way so they can see what some of this looks like. And so, yeah, don't be afraid to ask around for folks who are doing some of these things and just see how you can help, see what opportunities there may be. It may be something that's ongoing. It might be something that's just for one specific day, but man, there's so many opportunities for sure.
Absolutely. That was my first experience with screening. Was I reached out to a performing arts PT in my area, and I said, do you need help with anything? She was like, yeah, actually I do. I'm doing the screening. And then it turned into, oh, I'm going backstage. Do you want a shadow? Oh, can you write down everything I do? And I'm sure I was really helpful to her looking back on it. But in my head, I was like, oh, yes, I get to be backstage, even if it's for one day.
Mm-hmm. Yeah, I still remember my first day backstage. I got to shadow a PT that was with the Colorado Ballet during Nutcracker for a day. And oh my gosh, that was just like a life-changing experience. Still can't tell you anything that I actually did during that time, but
Nope.
man, it was super cool. And that was like, I want to do this. This is
I'm sure you wrote down some like manual muscle testing, and you probably didn't think anything of it at the time, but you probably saved the PT like 2 hours of thinking back through their documentation on what did I do with a person.
Yep. We both did well that day, that's for sure. So I think at this point, it is a good opportunity for a special segment on the show. So, on every episode of Dance Med Spotlight, we have the final bow. Essentially, this is the take home message for everybody listening or watching this episode. So, we've talked about a lot of things. What is one thing that you hope someone walks away with?
The biggest thing is that if you're a current dancer or current performer and that you don't feel like you have the resources that you need, reach out to somebody, even if they're not in your area, even if you heard someone on a podcast and you want to reach out to me via email or Instagram and you say, "Oh, I live in this area. I definitely need more help." Don't be afraid to reach out. The dance medicine community is very connected. And if I don't know someone or if I can't work with you, then I'll get you in with someone else, I promise. If you're a physical therapy student, don't be afraid to also reach out to somebody to try to help gain your experience. But then don't be afraid to rely on your own experience and your own expertise. Your lived experiences are just as important as somebody who came before you, and that the research is changing constantly. And if you're with a CI or you're with a professor and you hear something and you're like, that doesn't seem right, or how does this apply to dance? That was my favorite question in PT school. I'm sure my professors didn't like me at the time, but I raised my hand constantly. I was like, well, how does that apply to dancers? And how does that apply to performing artists? And if your professors don't know, they'll most likely look it up for you because they also want to know. But don't be afraid to ask that. A fun example of that is in class. So I teach anatomy for undergraduates with an emphasis on dance specific. And one of my students is a musical theater student. They're like, well, what about vocalist? And I was like, I need to look that up for you. And I was like, but you know what? I actually changed my curriculum and we're going to add a vocal section to our anatomy class, which normally I hadn't done. We'd learned about the neck in terms of bony alignment, but never about the muscles of the larynx and how vocalists work from that perspective, but we will starting next year. And so it's okay to challenge educators, and we don't know everything. And by you asking questions, it makes us a better educator and it helps your future students from there.
100%. I love that. Last and certainly not least, shameless plug, your opportunity to promote anything that you have going on, any shout outs that you want to do, whatever. This is your time.
I would say my biggest thing is that with the University of Southern California Performing Arts Physical Therapy Fellowship just starting, if you are a current residency graduate or about to be a residency graduate, or you have your board certification and you're in sports or orthopedics and you're looking for a fellowship, please reach out to me. We don't have full accreditation as of yet. We are hoping to achieve it starting in the fall, so that this way we can get our first fellow in as early as November or December of this upcoming year. And so we are looking for somebody if they are interested, with our formal application process starting next spring.
Amazing. Well, Marissa, thank you so much for your time this morning. It was great getting to chat with you today.
Thank you so much. I appreciate you having me.
Dance Med Spotlight is hosted and produced by Alyssa Arms. We discuss all things dance medicine. This has been another episode from Dance Med Spotlight. The Dance Med Spotlight is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present.